I've been asked to explain why one person or why a patient would need a crown, and I'm going to go through that. There's a number of reasons that somebody might need a crown. They may have cracked their tooth and it needs to be rebuilt to be like a natural tooth. Sometimes people have expectations to have their teeth whitened beyond what we can normally whiten them with bleaching. Sometimes we need to do crowns for cosmetic procedures, and for that reason we can dictate exactly the color of the crown and make it whiter than what would normally be obtained by bleaching. Sometimes crowns are used to reshape the tooth. Sometimes a tooth is either too pointy or it is malformed and too short or too little, and we can reshape the tooth because with the crown we can dictate what the shape of the tooth will be. So those are a number of reasons why somebody might need a crown. A patient, when they come in, sometimes they have old fillings where the tooth has been filled beyond it could be filled again, and for that structural reason we have to go to something that's larger, which is the crown. It sort of supports the tooth from externally like a girdle. It holds everything in. Fillings, in the other hand, are placed in the middle of the tooth and act as a wedge, so when you bite down it tends to crack the tooth. And this commonly occurs in patients that I would say typically 30 years and over, where their tooth has been filled when they were younger, when they were 6 years old or 8 years old. It was filled again when they were 14 or 16, and refilled again maybe one more time when they're in their 20s, and finally the tooth gives out and cracks when they're in their 30s, 40s, and so on. This day and age we don't see it as much because of the preventative dentistry that's going on, because there's plenty of 18-year-olds that are walking around right now without any fillings in their mouth, so it's not like they've been filled when they were 6, 7, or 8 and refilled again when they're 12, 13. Sometimes they've never had a filling, and sometimes they're getting their first filling when they're in their 20s or 30s or never.